Yeah, there was a story recently about a 39-year-old man, Adam Burgoyne,
Yeah.
who is so sad. He had posted on X, and I'm reading this for people listening, had a bit of a health scare last night, but thankfully it wasn't a heart attack. Not sure what it was though, because once they made sure I wasn't dying, I was thrown out into the waiting room, and 6 hours later I said fuck it and went home. Canadian healthcare folks, best in the world. I'll have to shave the rest of my chest, I guess. And he later died of an aneurysm. And the hospital didn't offer to take his blood or take any x-rays. He had commented on Twitter at that time, I suppose that might have happened if I had been willing to wait 18 more hours. And this is like standard across Canada now, our great healthcare system.
Yeah, there was the book chapter I was writing a month ago, and I looked into 2008, I think, in Winnipeg. There was a case of a man died in a hospital waiting room. Um, Brian Sinclair, I think was his name. And I highlighted it in the book just because it's a sharp contrast. So this man goes in for care. He's a double amputee, and he's sort of dismissed. He's forgotten in the waiting room, and for like over a day, and then he actually dies in the waiting room. And people don't discover his body for a while, so they think he was like dead for 3 hours until he was actually found. This was a huge scandal. People calling for the resignation of the Manitoba government, and they were saying, "Well, this is such an egregious failure." Like, Brian Sinclair was First Nations. They're saying, "Well, you must have been racist because this
Mm.
is so beyond the pale. You did it because he's a Native guy. You just assumed he was sleeping something off. That's why it happened." So this became a huge illustrative story about this is racism in the healthcare system. This is systemic failure, like multiple inquiries, an inquiry into the actual medical failure, and then another inquiry into like bias within the healthcare system. Again, so close the lip. Now this happens all the time, and it's notable. Like someone goes in for treatment, is put off for more than a day, and dies in the waiting room. That's happened, I don't know, half a dozen times in the past year. And the response is different because in the Winnipeg case, they're like, there's no reason this should have happened. If we had Brian Sinclair came in for a very easy ailment, he could have received treatment. It's because like 12 things had to fail for him to die. And now when it happens, you have hospitals saying, well, we've been at 200% capacity for like 2 consecutive years. There's literally nothing we can do. We are so overstretched. This is a tithe you have to pay now. And you'll see in all of those cases, the reaction might be a little different in the case of Adam Burgoyne, but in a lot of these cases where you have just egregious failure, someone dying while waiting for care, they say we're run off our feet. We did the best we could. We screwed up the triage a little bit, but if you overstretch your hospitals to this point, that's what they're going to be. So, yeah, it's definitely Canadian healthcare has always been not great. Well, not always, but I would say this is a problem that goes back further than Justin Trudeau, say. We've always had, well, for a long time, we've had longer than average wait times, et cetera, et cetera. But it's gotten egregiously, noticeably bad now. Like, for example, me and Victoria, when I was growing up, you could probably get a family doctor, and you could actually walk into a medical clinic, a walk-in medical clinic, and you could probably be seen within an hour or two. Now, there's essentially no medical clinics. They all book up. They open, they take calls, and they're booked up within 10 minutes.
Oh my God.
You cannot get a family doctor under any circumstances. So if anything happens to you, even if it's just like, is this a lump? You have to go to the emergency room, and the waits can be like 6-7 hours. So we're getting to a point where, people are like, I don't have any health care. Like,
Yeah.
this isn't, private, or like, it doesn't matter if it's public or private. I can't get it. So it doesn't matter who's paying for it at this point. So I think that's happening to enough people. And again, it's beyond anything. It's kind of a level of failure that's sort of new in that regard, like a lot of our things lately.
Yeah, I have the same memory and history that you do, which is like when I was a kid, we had a family doctor, and then when I was a teenager and through my 20s, it was easy to just walk into a walk-in clinic, and you usually didn't have to wait all that long. And this is what I've heard from Canadians, my friends back in Canada, is that you can't even get into a walk-in clinic. It's What's happened? Why have
Like
things
it
gotten so
becomes,
bad?
and this has happened to me. Like I've just had to renew a prescription, and it becomes like you have to have a plan to do it. Like just the idea that you would get the service you pay for. So you're like, okay, well, I've got this, like, you know, I remember that doctor we met at the party. Maybe he would, I could call him and we could get it. And okay, he's busy. He's not letting me in. So there is this. I heard about this. I heard about this like other clinic you can go to. This is like an emergency care clinic. You can get in there, and if you get in early before 8:20, they might be able to see you same day, at least with a telephone appointment. So everybody with minor ailments, you have to have. I'm not going to compare us to a communist country, but yeah, like in a communist country, we're like, how am I going to get my car fixed? You have to have a scam going on to actually get something done because the shortages are so acute.
This is crazy. What's happening here? Is this all just understaffing?
A few things I would argue. Um, I mean, you could sort of, I think, like I mentioned, Canada has a unique approach to socialized medicine. So, an American hardcore, free marketer would say, well, socialized medicine is the initial problem. But the reason it's worse here, and it is worse than, I mean, when you compare us to Germany, France, all these other countries, and we're getting killed on sort of beds per capita. We're getting killed on waiting times. We're spending quite a lot, and we're not getting as much. And not compared to the U.S., because we always compare ourselves to the United States. And actually, the U.S. is starting to pull past this in terms of people who cannot get healthcare for whatever reason. The U.S. has actually just pulled ahead of us on that. So we have more people not able to get care just because it isn't available, versus Americans who can't get care because they don't have insurance. So anyway, we always compare ourselves to the U.S., but compared to all the other socialized systems, we're lagging. So I would argue a big part of that is because we have such a tight monopoly on how healthcare is handed out. So under the Canada Health Act, any procedure that is covered by the Canada Health Act, it is illegal to get private insurance for that procedure. So you cannot go to a hospital and use your private insurance or get something insured for private insurance for, say, like a hip replacement, because that's covered by the government. And if the government covers it, no one else can cover it. Nobody else does that. Nobody, except maybe Cuba. So this would sound completely foreign to an Australian, to a French person, to a German, to a Korean, to a Japanese person, even in China. There is the public system that providing the basics. And then if you don't want the public system, you can pay for health insurance, and then you can sort of access a private system on top of that. For some reason, we don't allow that. So it's a particularly centralized form of controlling how healthcare is rationed out. And then as a result of that, we have a lot of people don't know we do this. We ration the number of doctors that can enter medical schools. So the government actually controls how many students are allowed to be accepted into medical students, into schools. And they'll actually dial it down because the supposition is, well, the government's the only one who hires doctors. So if you graduate too many that we can't hire, we have a lot of doctors. So you've seen provinces say, well, actually, we're going to cut the amount of students you're allowed to let in because we're looking at 4 years from now. I don't think we can employ that many doctors, given our budgeting. Now, imagine if you did that with any other profession. If you just started restricting the number of auto mechanics or dentists or anyone else, you would probably start seeing shortages similar to what we see in Canadian healthcare. So I think you can preserve the public system if you just say, okay, here's a public system. It does the basics. And because as a result of that, when you've decided that the public system covers everything, there's all number of sort of elaborate procedures that we cover in the public system that in a normal country like Germany or France would say, okay, well, you cover that with extra insurance. We cover the basics here. And then anything else, you can get private insurance to cover it. And then as a result, if you have a private system, there's other people paying the doctors, and you can have a net increase in the number of doctors you're paying because you don't have it's actually not a monopoly, it's a monopsony, single buyer. But it's just, keeping the screws that tight on how the healthcare system is run and just complete fear of anything. And you've seen it. You can look at Hansard parliamentary records. Anytime someone brings up, maybe we should bring in, a private system, so that we're not the be all end all of healthcare, and this could exist next to the public system, similar to the way we run private schools and public schools. And anytime you brought that up, just immediately, like you were trying to bring in American style healthcare. So I don't think that's as potent anymore. I think now, if you mention a radical solution like a two-tier system, you can try yelling at that person and saying they're trying to bring in American style healthcare, but so many of us have, just experienced situations in which there's zero healthcare on offer anywhere. It just rings hollow.